Let's bring in emergency physician and ABC News medical contributor, Dr. Darian Sutton. Dr. Sutton, good morning. Let's start with this new development out of the UK. They've announced an update to their vaccine guidelines, allowing vaccines to be mixed and matched in cases where a second dose might not be available or if the manufacturer of the first shot isn't known. This contradicts CDC guidelines here in the States, though. So what's your take on this?
Good morning, Diane. While I understand why this is being done in an effort to vaccinate as many people as possible, this is really venturing into uncharted scientific territory. So I would advise against it because it's based off of information we simply do not have.
And then the UK is also delaying second doses of the vaccine to instead give as many people as possible a single dose first. Now, a California doctor is suggesting the U.S. consider doing the same, but Health and Human Services Secretary Alex Azar said on GMA this morning that the U.S. would follow the data and do 2 doses. So what do you make of that? What does the data tell us here?
So right now, the data is very limited. Right now, Pfizer has a statement that states that they do not know what information or efficacy after the first dose. And we have some little information from Moderna about the possible efficacy that is available after the first dose, but it is nowhere near the efficacy that was reported around 95% after both doses for both Pfizer and Moderna. I think right now, doing a single dose shot is not only at risk of leaving people partially vaccinated with a false sense of security, but it also can undermine the public trust and complicate the availability, the understanding of how this vaccine works. And we've been working so hard to get everyone to understand the simple benefit of getting both doses. So it would make it a lot harder.
And now that the holidays are over, the fear is that mid-January could bring what Dr. Fauci called a surge upon a surge and a really dark time. Now, is there anything that can be done to prevent this at this point? Do we need more restrictions here like we're seeing in the UK, for example?
While I don't think that blanket restrictions are something that is effective, I do think that targeted restrictions are important. For example, here in Los Angeles, our surges are complicating and maximizing the capacity available in hospitals, making everything difficult. So I do think that when rates become high enough and hospital capacity becomes high enough, that restrictions need to be put in place to help tamper that. But across the United States, every state is a little bit different. I think also that we need to augment testing. Right now, according to COVID Tracking Project, the highest amount of testing that we've seen on a daily basis is around 2 million. And some scientists and analysts suspect that we need approximately 9 million tests available to Americans in order to help people understand their diagnosis or the possibility of them having COVID-19. And we also need that testing to be efficient so that they get the results quickly. A lot of these variables need to be put in place to help decrease the amount of people coming into the hospital.
All right, Dr. Darian Sutton, always great to get your take. Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.